About 2,000 Canadians are killed every year in car crashes. About 1.2 million people are killed every year worldwide in car crashes. Humans are terrible drivers, and I just gave you two pieces of evidence to back up that claim. Yet despite all that, whenever we talk about a possible solution, self-driving cars, we seem to fear them. Our next guest has sadly seen a good amount of victims of car crashes and has decided to look into this further. Recently penned a piece in the New York Times on the subject. Let's go to Dr. Jonathan Slotkin, a neurosurgeon and the chief medical officer at Geisinger Health System in Pennsylvania. John, welcome to the program.
Elias, thank you for having me.
You start off your piece in the New York Times with a story about being called in to see a teenager who had just been in a car crash. Why don't we start there? Why don't we start with what you see?
Yeah, me, thousands of other nurses, doctors, therapists across North America and the world. I think we've really had enough with what we're willing to accept as cultures for the price of mobility. These injuries tend to strike people and deaths that are completely healthy or very healthy, often in the prime of their lives. Worldwide, between the ages of 5 and 29, automobile crashes are the leading cause of death.
Wow.
And in the United States, number 2 cause of death for children and young adults. And similarly, Canada, of course, you do significantly better than us down here in the States, but also a problem up there. So look, Elias, we in this field, we literally have blood on our shoes. And it's time that there's a solution that we can pursue as societies to change this.
So it seems like we are pursuing the solution. I've had the opportunity to ride in a Waymo taxi. That's a self-driving car. When I was in Arizona once, I have a Tesla that has that, what they call their full self-driving supervised feature. I see it on a daily basis that it's safer. What's standing in the way right now, John?
Yeah, so there are a number of things. One, price, right? So for the fully autonomous vehicles, like let's say Waymo, as opposed to a human supervised like you and many others in their Tesla, right now you're looking at about $100,000 on top of the price of the car. So right there, scalability is going to be increased greatly when the price of this comes down. And you've covered tech for a long time. As you know, the prices will come down as market pressures start to push it downward. Now, also, there are entrenched, and I'll tell you, Elias, very moneyed forces that are against this. In some areas, for example, it's plaintiff's bar. And, folks could research or use their own imaginations for the various reasons why that might be. And in Washington, D.C. and Boston right now, for example, aspects of the city council are significantly opposing this. But what I would tell you, Elias, in my view, it's because they really haven't seen the data. And what I would say to them now is, this is not a tech story anymore. This is a public health story.
Well, let's talk about the data. What is the data telling us already about how much safer these systems are than a human behind the wheel?
Yeah, so what prompted me to look into this was, about 6 or 8 weeks ago, Waymo, as it's known to do frequently, published all of its raw data. And I mean data files that anybody, and particularly now with LLMs, anybody can take these and perform their own analysis on this raw data. And I thought, wow, this data is too good to be true. And I spent weeks and weeks reanalyzing it myself. And we're seeing statistics, Elias, that are stunning from a medical and safety point of view, which is greater than a 96% reduction in intersection crashes, which are some of the worst we see. Greater than about an 85% decrease in significant injury or worse crashes. So those are the worst ones. Greater than 90% decrease in pedestrians being struck. And these numbers, Elias, are statistically significant. So not to get too inside baseball, but that means really these are likely to be real effects. And what I say to folks, Elias, is that if a medical treatment or prevention was working this well, and this many people were dying every day, we would declare a war on this disease and say we need to bring this prevention tomorrow. Well, that's where we are, Elias.
We're with Dr. Jonathan Slotkin, a neurosurgeon and chief medical officer at the Geisinger Health System in Pennsylvania. We're talking about the safety of self-driving cars. Despite everything you say, doctor, when I have conversations with people who don't know about the technology, and I ask them, like, hey, would you own or be driven in a self-driving car? Oh no, that's so dangerous. Like, the public perception is that letting a computer drive is more dangerous. How do we change that?
Yeah, it's so interesting you say that. And because we face that in healthcare a lot, which is people are often afraid of things that actually are beneficial to them. And I think, it's human nature for all of us. We fear, for example, like the robot that we perceive we can't control, but we think, oh, I can drive on 5 beers because I'm better. I'm good. I'm a better driver than the guy across the street. And, but here's some of the real truth, though. The robot doesn't get distracted. It doesn't text. It follows the rules always. It doesn't get tired. And so, look, it's true. This technology is not perfect. We've all seen videos. These cars can stall or get confused. But what I would say to people, and the data shows this, is that when they have issues, the issues tend to be minor and safe, like the vehicle pulls over to the side of the road. But we know that it markedly decreases. And in North America, the 40,000, where we have 38,000+ and you have 2,000 north of the border on the lovely side, we're having one jet aircraft, a big one, 100+ people drop out of the sky every day. And that's not counting the hundreds of thousands of people that are permanently disabled.
Yeah.
So, it's time to do something.
So just to wrap up here on the regulator side, right? Because you touched on it earlier, like you've got some city councils that are trying to ban these things or delay them at least. What's your message to regulators on both sides of the border here on what they should be doing if a company comes to them and says, hey, we want to test these things on your roads?
Yeah, so I would say, like any well-made decision, let the data be the guide. And the data is very strong, but let's say it's a new company or a new entrant. Absolutely. Demand to see transparent data. Demand to see miles driven. What's the denominator? What are we really comparing this against and how? But then I would say to them, we need to put the politics aside here and really step back and say what's safest. And, one of the concerns, and it's a real concern, Elias, is about jobs, right? Like, what's going to happen to drivers?
Yep.
But look, in 1981, in the United States, in North America too, we consumed 640 million cigarettes that were rolled and involved jobs. And now it's down to about 150 billion. And now it's down to about 150 billion. And somehow we didn't have a job crisis. We upskilled people. We found things that were safer for these people to do. And I'm confident we will find a way through this too, Elias.
Maybe my most difficult question, what kind of car you drive?
Yeah, so I drive a car that, like yours, has close to one of these supervised full safety, partial autonomous features. And it's not a Tesla, it's by another maker, but I use those features quite often. And I also, like you, I have the lived experience that it's safer and faster than I am.
John, I got to leave it there. Really great discussion. I'll tell our listeners to seek out your piece in the New York Times. It's titled, Don't Fear Self-Driving Cars. They Save Lives. Be well, John.
Thank you, Elias.
That's Dr. Jonathan Slotkin, neurosurgeon, chief medical officer at the Geisinger Health System in Pennsylvania.
I'm Dylan Playfair.
And I'm Tyler Smith.
We're putting loneliness in the penalty box by talking to some of our favorite athletes about the importance of friendship.
This is Bromance.
Bromance is brought to you by Charm Diamond Centers, proudly Canadian-owned and operated. Charm has been part of your love stories and bromances for over 50 years.
And you can find Bromance on the iHeartRadio network or wherever you get your podcasts.